How's your brain health? In today's video, I'm going to be sharing information from an updated brain health report that was presented at the ECTRIMS Conference recently and share some tips on how we can support our brain health. ECTRIMS stands for the European Committee for Treatment and Research in Multiple Sclerosis. Every year they have a conference that brings together researchers, clinicians, and healthcare providers to share information about MS and current research. At the conference, an updated MS brain health report, which I will link below if you'd like to check out all 56 pages of it, was shared. This report was started in 2015 and it has an impressive list of 17 worldwide contributors, including Gavin Giovannoni, who you may be familiar with. In the foreword of the report, they talk about having regrets when it comes to improving health and alleviating pain and suffering. If only treatment was started earlier, if only there were more resources, if only there were more time to devote to improve the lives of people with multiple sclerosis and other neuroimmune conditions. They go on to say, if only can become an impetus that shapes our goals and conjures a vision for change. Our hope is that this report will challenge each reader to see beyond if only and seize the opportunities that we have now. I kind of love this. We can seize the opportunities that we have now to improve our brain health. On my channel, I try to share evidence-based information, my own experience living with MS for over 18 years now, and tips to help us live well with our disease. I'm hoping to change the narrative of you have a progressive, degenerative, incurable disease to you have a condition that can be managed with medical care and diet and lifestyle changes. Sounds a lot nicer, doesn't it? In the executive summary of the report, they include this. But most critical is to involve people proactively in shared decision-making and empower them to manage their diagnosis through holistic care and to adopt a lifestyle that maximizes their brain health, including non-smoking, keeping as active as you can, and improving sleep. I'm going to focus on Section 4 of this report, Optimal Management and Person-Centered Care. And this is the section that shares how important a more holistic approach to living with neuroimmune disease is. It talks about empowering people to work with their health teams on the decision-making process, including a bigger focus on the evidence for making positive lifestyle choices. Making positive lifestyle choices. We have a choice. We can decide how to change how we live. We can make choices every day to support our brain health. When they say person-centered care, they want to include the person with a neuroimmune condition in making the decisions about their care and also provide support to help them live in a way that encourages overall health. There are 6 areas that are included in this section that are important to overall health and well-being. Physical therapy, occupational therapy, dietetics, mental health services, exercise physiology, and speech and language therapy. I love this so much. There are so many things that we can be doing to support ourselves or our loved ones with MS that involve more than just our neurologist. Can you imagine how beneficial it would be to have support in all 6 of these areas and to be involved in the decision-making process? In the report, they share that in surveys done in Europe and in the US concluded that about 2/3 of clinicians do not involve people with MS in their treatment decisions, and that shared decision-making can improve patient well-being, quality of life, and treatment satisfaction. Who wants improved well-being, quality of life, and treatment satisfaction? Anyone? The report goes on to say that although information is widely available about access to evidence-based material and peer support about potential challenges of stigma, prejudice, and discrimination, and how to optimize quality of life, many people with neuroimmune diseases do not receive assistance with this. I want to encourage you to discuss with your doctors how you can be involved in the decision-making process for your treatment. I created a handout with the 6 items listed in the report that you can bring with you to your next appointment. Ask your doctor if there are treatment options for you in each of these 6 areas, or start a discussion on how you can proactively support your health in these areas with things that you do outside of your annual or semi-annual exam. I encourage you to be your own healthcare advocate or enlist the help of a partner or a loved one to come with you to appointments to advocate for you. This section of the report goes on to talk about how we can optimize our physical health to support treatment outcomes, how choices we make in our day-to-day lives can help our treatments to work better. Included in the report are optimizing physical health by managing alcohol consumption, stopping smoking and avoiding exposure to cigarette smoke, engaging in regular physical exercise, maintaining a healthy weight, getting adequate sleep, and managing coexisting medical conditions such as high blood pressure, depression, and other mental health disorders. We have the ability to make smart choices with what we consume, how we move our bodies, how we rest, and how we support our mental health. We can choose to make lifestyle changes that promote brain health. I have a 4-pillar approach that I take to support my health in addition to my medication: diet, exercise, sleep, and kindness through compassion and mindfulness. Maximizing our brain health throughout our lives with MS is critically important. We can eat foods that support brain health, like dark green leafy vegetables and berries and whole grains, and foods rich in omega-3 fatty acids like flax seeds, hemp hearts, chia seeds, beans, and walnuts. I did a video on the book Brain Food by Lisa Mosconi that I'll link above and below if you'd like to check it out, and I'll put a link to the book in the description too. Exercise is really important for brain health too, especially aerobic exercise. There's more and more research showing that it increases well-being, cognition, and mental health. And not only that, it's neuroprotective and may help with remyelination. I recently did a video on more benefits of exercise that I'll link above and below too. Getting enough good sleep is key as well. It's important because it affects how our nerve cells communicate with each other, and when we sleep, our brains clean out toxins. And over a lifetime of good sleep, between 7 and 8 hours a night, can help us improve our brain volume. To see more on the benefits of sleep, check out this video. And lastly, kindness through compassion and mindfulness. There's not a lot of research on brain health and mindfulness, but there is some that states routine meditative practices are associated with long-lasting changes in the topology of definite brain areas and suggests that meditation might be able to induce brain plasticity. It can definitely help with managing our symptoms and our overall well-being. To see more on the benefits of mindfulness, watch this video next. I'm excited to see the shifts in Western medicine towards taking a more holistic approach to treating diseases like MS. If we can combine medication, therapies, and diet lifestyle changes, I believe that we all have the ability to live well with our chronic illnesses. What do you think? Does seeing these changes being presented at conferences like this excite you or give you hope? Let me know in the comments below. Thanks so much for joining me today. To support this channel and to help it to reach more people, please share this video, like, and subscribe. Until next time, be well.